Hi everybody, this is Dr. Lauren Allison with MasterTheBody.com, and today I want to talk to you about blood pressure, hypertension, and breathing. Did you know that the CDC has reported that 75 million people in the United States have high blood pressure? Now, and of that number, barely half is even regulated with medication or otherwise, which is a very big number. Now, there are a lot of statistics with high blood pressure, and there are a lot of symptoms that come with it and problems that it causes, which you can find next to this video or below on the post that I made about it. But what this video is about using breathing, specific breathing exercises to actually lower your blood pressure. Now, that probably sounds like a bunch of garbage, but there is real research and clinical data showing that it really works. And that is next to or in replace of medications. Now, there are devices and apps you can use, which I've listed a couple of things below the article attached to this video. But what I want to impart to you is that with breathing, you can actually control some of your nervous system functions. And when you control those aspects of your nervous system, it changes the way the blood vessels flex. And so you can control your blood pressure fairly easily. We've all heard in high school biology, fight or flight. And now most people are aware that that is your nervous system that does that, like your sympathetic nervous system. And your parasympathetic is the relaxing part. So with blood pressure, usually it's too much sympathetic nervous system activity and not enough parasympathetic. But did you know that if you even your breathing cycle, meaning you inhale for the same amount of time that you exhale, so a 4-second inhale or a 5-second inhale, followed by a 4-second exhale or a 5-second exhale, actually brings those two systems in line, meaning sympathetic and parasympathetic are balanced. And what they found with the research is that when you do that, the nervous system relaxes and your blood flow and your cardiovascular system relaxes, and it lets off some of the tension in the vascular system, and your blood pressure is able to reduce. So the key with that is that you're breathing 10 cycles or less per minute, meaning an inhalation and an exhalation is 1 cycle. So if you're going to inhale for 4 seconds and exhale for 4 seconds, that's 1 breathing cycle. So 3 seconds inhale and 3 seconds exhale 10 times is 60 seconds. So you need to do at least a 3-second inhale and a 3-second exhale or greater, 4 seconds, 5 seconds, 6 seconds each. And continue to do that for 10, 15 minutes at a time. And this is the exercise that will actually help you reduce your blood pressure in a couple of weeks, possibly sooner, depending on other lifestyle factors. Now, there's machines out and apps out that will guide you through that breathing process. And something like the Respirate Machine, which is well researched actually, proven to lower high blood pressure with standardized Western studies, where they use a chest strap that senses your breathing cycle and then helps guide you with tones and earphones to breathe for the appropriate amount of time for each inhalation and exhalation. There are apps that also do that, which you can choose to use those, and I think for a lot of people it makes it a lot easier. But the overall is you could also count 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. If you're looking for the absolute low budget, no cost version, and you set a timer and do that for 15 minutes, and you will actually be doing exactly the same thing that one of the apps or the computer units would train you to do. What they found was that if you can do this at least once a day for 2 weeks, you'll get a substantial reduction in blood pressure. And then after that, to maintain it, you only need to do it a few times a week. But I think it's really valuable for people to realize that it's something that doesn't cost anything. It's not something you ingest besides breathing in air. And it's very simple to do, and it doesn't take a lot of your time. But what I hear especially in the last few years in my practice and in the Master the Body Clinic, is people looking for natural solutions, because a lot of the time the blood pressure meds don't actually work 100%. So I've seen people use blood pressure meds and breathing. I've seen people use breathing without any blood pressure meds and still get great results, or other natural methods or nutrients, herbs and so forth. But the breathing has proven to be a very, very valuable way to control your blood pressure in a simple, efficient, effective, no-cost way. So check the links, check out my post about breathing and blood pressure regulation, and I hope this helps you a lot. Thanks for watching.